Hi, everyone. Welcome to Ask Julie Anything tonight. Hey, Julie. Thanks for joining us. Julie and I were talking behind the scenes, and we thought it would be kind of cool to gear this open-ended questions towards allergies, since a lot of dogs have been writing, or a lot of people have been writing in about their dogs experiencing allergies. So let us know in the chat, first of all, if you can hear us. There's a chat option. Hello, everyone. And if you could change your reply from all panelists to all panelists and attendees. Zoom automatically goes for all panelists, and then not everyone can hear the conversation. And if you've got, yeah, it's kind of weird.
Are you asking me to do that?
No, I'm asking the attendees. And if you've got Q&A, do me a favor, put them in the Q&A section at the bottom of the session, and then we can start asking away. What are you nibbling on, Julie? Anything good?
Chocolate.
Ooh, yum. It's about that time, isn't it? Everyone can hear us. Sabrina, hey, that's one of my girlfriends that's joining us, Julie. Robin, hi. Sheila, hey. Kim, nice to see everyone here tonight. All right. Why don't we, Julie, if you want to gear this topic towards allergies, why don't we start by...
Well, you know, there's a lot of people in the chat and stuff. Why don't we find out if anybody out there right now is dealing with skin issues with cats, dogs, if anybody has any allergy stuff going on. Why don't we ask and
I think
see
that's perfect.
what everyone is saying. Because I thought I was going to actually have to use this, and I didn't have to use it. That's awesome. Because then maybe we can start asking, like, what's going on with people, like what's happening.
Yeah, I got a couple questions here.
2 4-year-old. Oh my goodness, my dog has allergies. Skin issues is the most common. Yeah, Donald Middleton. Yeah.
Lifelong allergies. Environmental allergies, chewing on their paws.
Nasal, I have nasal and oral issues. She does, or her dog? Oh, vet thinks.
Her dog, yeah.
What does it say? Vet thinks what?
It could be allergy related. We aren't really sure after many tests.
Okay.
Nasal and oral issues.
All right.
And I have Q&A coming in too as well. My dog.
Okay, so we can start with a Q&A on it, and then we can move into a bit more. How would you deal with genetic, what does that one say?
Allergies, genetic allergies.
Ask her to put them in the questions so that I can see them in the questions too. Let me look. Okay, my attacked by allergies. Oh.
Anna. So Anna's dog, 1.5-year-old West Highland Terrier, attacked by, how the heck did that happen? Attacked by a large... No, I got it here. Attacked by a large dog at the age of 6 months, had a metal plate surgically put into her jaw fracture. She had a C1 vertebrae and cheekbone fracture. When we brought her home from the hospital, she started pawing at her nose periodically throughout the day. We thought it was due to the fractures. Today, a year later, still paws at her nose and rubs her chin and lips until they're sore on the carpet. We have been on to numerous vets, and they keep doing skin cytologies, seeing bacteria on the skin and giving us antibiotics. They don't seem to help. In the last year, she's been on 4 rounds of antibiotics and had 2 ear infections on the same side that the metal plate is in. I switched her to raw and kefir about 8 weeks ago, and the skin issue seems to only have gotten worse. Her demeanor has improved, but her nose and lips under her nose look swollen and are still red. I considered doing the Yeasty Beast protocol, but I'm not sure.
Okay. All right. Well, okay. And then what's the other one? The Tibetan Terrier with mast cell tumors on the base of his tail is broken open twice. And half the size. It's on homeopathy. Any suggestion they might deal with this? My dog just started scratching about a week ago. I'm wondering what the best natural remedy is to give. What supplements might go well with homeopathy? Doing skin cytology. Oh, right. Okay. Hi, Julie. What is the bottom line for dealing with yeast with regarding to using fermented foods and probiotics? Can you give too much of these that may further? Yes. All right. Let's, and we're seeing lots of biting and chewing. What am I going to be supporting all the dogs? How would you deal with genetic allergies? All right, so let's maybe start with what I even think allergies are.
That'd be great.
Because a lot of animals are diagnosed with allergies and they really aren't allergies. They're actual reactivities. So they're hypersensitivities rather than a true allergy. Prevention wise, I've always thought of what two things for me contribute highly to either reactivity or allergies. One is over vaccination, so vaccinating an animal for a type of disease that it already has antibodies to. Because what happens in that case is that the body gets forced into a reactive state. Because if let's use parvo as an example. So normally how a dog would build antibodies to parvo would be like slow immunization, or being vaccinated at 12 weeks and then just one more vaccine after that, and then it builds the antibody, and then it walks through, or it gets parvo and then it builds an antibody through getting parvo. So those are all natural ways that the body is able to see that there's a virus, and then be appropriate in how it responds, which is then by building an immunity to that disease. So what happens is when all those immunities are there, and we talk about boostering vaccinations, it's a bit of a it's not really the correct term, because once you don't booster something that's already adequate. Like you can't, it's not like topping it up. So it either is there or it's not there. So when you inject a vaccine into a body that already has antibodies to it, what happens is the body goes into a reaction that it needs to kill. So it needs to find something to kill for the body to go, okay, I've killed this enemy, so I'm going to stop now. And often what happens is it will kill or become reactive to proteins that it's finding in the body that it shouldn't be reactive to, like flea saliva, dust mites, chicken protein, grass pollens. It attacks them, and then it becomes, it either saves it almost like an immunity or like an antibody, or it can create a reactivity to it, so that the next time it is exposed to that sort of passive antigen or passive protein, then it becomes reactive. So many times that dogs are diagnosed, or cats are diagnosed as allergies, and they really aren't true allergies. So that's one way. The next way is that the dog's or cat's microbiome isn't strong enough, and it starts to get gut trauma, and then instead of the gut holding these passive antigens through, they walk through the grass and they lick their foot, and then they swallow those grass pollens or their inhalant, and it goes down, or however the way it gets down there, it's supposed to stay in the gut and then pass through the intestinal digestive system and out through the feces. But when there's holes and trauma and leakage through the mucosal lining, the structure of a junction, or like calling it a leaky junction, which is the gut is supposed to be very tight like this, and then tiny microscopic in a way holes like a tea strainer is how the micronutrients, after the body digests the food, gets through and feeds the body. But when the gut's been traumatized, it opens up, it stretches, it gets stiff, it stretches, and it becomes damaged, and there's holes in it. So then you get all this leakage into the bloodstream of things that shouldn't be in the bloodstream. Again, like chicken protein, dust mites, flea saliva, pork protein. It's like you put your animal or your dog, it's got a food sensitivity, you stick it on pork, and then, but you're not dealing with the gut issues. So then what happens is it goes, oh, wow, awesome. I feel great on this pork because I haven't had it very often. So I don't have a reactivity to it. Careful, Henry. But then if you're not dealing to heal the gut, then that pork protein keeps going through the mucosal lining into the bloodstream, and then eventually it reacts to the pork protein as well. So that's this constant wheel of not reactive, becoming reactive, not reactive, becoming reactive. So those are the two, and I saw someone talk about yeast too, and yeast is a similar situation. Yeast is normal. Yeast is yeast should be on skin, yeast should be in the gut, yeast should be there the same way as certain kinds of pathogens, right? Like things like E. coli and salmonella and things like that. Those things are in animals are fairly normal, and they're not pathogenic, or they're pathogenic, but they're not threatening when they're kept at a very low level. So when we give antibiotics, when the microbiome in the gut is not, doesn't have the diversity and isn't able to keep that's when it's not able to keep the yeast at bay. So when a dog or a cat or a person takes a lot of antibiotics, it destroys the microbiome, the friendly bacteria that would keep the yeast and all the other pathogens in small healthy numbers. So when we look at allergies, we want to make sure that we're not just trying to treat the skin, and we're treating it from inside out, right? So it's just the skin is the top layer of what's going on a deeper level. So anybody out there that has a dog or a cat or a horse or yourself or anything that has any kind of reactivity, sensitivity, whether that's summer allergies, spring allergies, fall allergies, environmental allergies, food allergies, or sensitivities, you want to be looking at your gut first with animals, over vaccinating them, so that you just sort of kind of get them on track. And then I used to see this at my clinic all the time. It'd be like, yeah, I think he's got fall allergies, or I think his allergies are the spring, they're coming in the February or whatever. And when I would look at their chart, it'd be like, oh yeah, you can see that it's tapering off and he hasn't gone to the vet for a while, and so obviously he's better. And then he goes in for his vaccinations, and then literally a month later, he's right back in, and he's on prednisone and Venectal P and all the skin stuff. So it triggers it again. So be really, really careful that you're not over vaccinating. Make sure that you're paying attention to the gut big time, and work with topical stuff. So let's talk a little bit really fast, and then we're going to go into a little bit more about what you can actually do for allergies. But we have to remember that the skin also has its own ecosystem. So when we're using really heavy duty bacteria soaps that have bacteria in it, soaps that have washing the animals a lot because they're stinky, because they do have skin problems, which I understand. But every time we're using something that destroys the natural biome on the skin, you're creating a complete clean palette for all kinds of other bacteria to grow. So we want to keep the bacteria and the diversity of the bacteria on the skin equally as diverse and strong as the gut bacteria. So you know, using things like Castile soap and not using soap that has, you know, that's really, really harsh. So using really, really gentle soaps, and then trying not to use soap hardly ever. Like letting them get dirty. I always say that, like if they roll around in dirt, try to just let it dry and then brush it off. Don't wash it off. If you have to absolutely wash them, maybe you can just use water and then use green tea and chamomile tea, a mixture together, and rinse them with that. And then if you do have a dog with skin or cat with skin stuff, then you can get a really good probiotic. We use love bugs all the time. A good probiotic, it's got 14 strains. When I say a really good probiotic, I mean a probiotic that has multi-dimensional, multi-diversity in their strains. And mix it with some kefir or yogurt, and then literally make a mask. Put them in, and if they lick it, it's fine. Put them in the bathtub and see if you can leave it on for at least 10 minutes, and then don't wash it off. You just rinse it off with warm water, or again, you can rinse it off with chamomile and green tea, or you can just use a chamomile and green tea, rinse at the very end, and then you don't rinse that off, you leave it on. So yeah, there's a lot of things that cause animals to have massive skin issues. Another one is their cortisol levels being really high from stress. So, you know, look at vaccinations, look at their obviously diet. If you're feeding a diet that's not species appropriate, or you're feeding a diet with lots of grains or lots of corn or lots of peas or lots of lentils, be very careful with your dog food packaging, because lots of times it says no grains, but then there's lentils and peas in it, and that can be even more reactive than grains. So, you know, and if you have to use a dry food, like you have to use a dry food, then soaking it with bone broth. And then adding a digestive enzyme to it, like we have our healthy gut. So when you add the digestive enzymes to it, and then you add bone broth to it, you're making the food way more digestible. So already when they're eating it, it's partially digested, one from the healthy gut, and two because you're softening it, and then the dog is able to actually absorb what's in the food. Because if you don't wet it and you're feeding just dry food, chances are they're not absorbing very much of what's actually in the food. So doing that will help with the biodiversity and gut health. If you are, so, you know, if you can't do raw and you can't do cooked, at least do the bone broth, healthy gut, and dry food, and then add as much as you can. So, you know, maybe every second day, give them a can of sardines, or half a can of sardines packed in spring water. Save your cooked meat, that so long as it doesn't have a lot of spices on it or onions, things like that. Give them cooked meat, give them some cooked broccoli, give them anything that's healthy that you're eating yourself. Just give them table scraps if you have to stay on dry food. So okay, let's just recap that a little bit. The majority of stuff that's diagnosed with allergies aren't actually allergies, they're reactivity. The reactivity usually comes from being over-vaccinated or poor quality microbiome in the gut. So you want to be paying attention to the gut. And then the next one can be stress. So, and stress and diet. So that's where you have to start, no matter what you've done, no matter how long your animals have been on drugs or whatever. You need to start looking at those 4 or 5 things that I just mentioned. So let me look. Didn't realize harm was being done. Diet conventional meant at 1 year stopped everything and trans diet. My dog now has stopping these. Yeah. Those are questions. Lifelong infected ears, 10 years old, no vaccines in many years, no chemicals on or in, multiple vet cultures. Vets only suggest taking ear canals out. Don't have a holistic vet in my area. Raw fed for 7 years. She's now scratched and torn the skin around her eye. Yeah. Okay. So, Robin, I would get a consult with, and Katie Kangas does, um, uh, Zoom, Zoom meetings. Stephanie, maybe you can put Katie Kangas's information in our chat. She's an incredible holistic vet. There are holistic vets out there, but what happens a lot of times with this is that you get scarring, right? So they get ear infections, and then from the inflammation, the bacteria goes into the ear, or it's coming from underneath out, and then it irritates the skin, especially if it's yeast. And then the yeast, then the ear canal becomes thickened, or like swollen and thickened, and then there's less air going down, less oxygen. So then it just breeds like crazy, like absolutely crazy. So I have worked, sometimes I've seen that. I have seen that. A couple of my clients have come to me post that surgery. But I've also seen incredible stuff that we've been able to do that have prevented those surgeries. So one of the things are, there's a homeopathic remedy. The other thing is Andrea Ring. Andrea Ring is incredible. She's a wonderful homeopath. She'd probably be able to help you with that too. But putting him on homeopathic medicine, homeopathic remedies that deal with scarring, brings down the inflammation and actually treats the scar tissue. So not just the inflammation, at the same time dealing with pain, at the same time dealing with infection. There is a lot you can do. So it would take me too long right now to be able to figure out how to help you with this. So I would either get in touch with Dr. Katie Kangas or Andrea Ring, who's a homeopath. They would be able, I know that they would be able to help you. I'm sure of it. And if Robin, if you're talking to either two of those people, I mean, Andrea will know because Andrea worked in my practice. They tell them they can reach out to me, no problem, about a specific remedies that I use to decrease the actual scar tissue in their ear, and I'd be more than happy just to let them know what that is, and then they can incorporate it into the plan. So mast cells, yeah, that's a big one. Stephanie, what else is in here with hang on, 5-month-old son has not any vaccination. She's been taking noses. When should I consider titering her? Okay, we'll get back to that one. Red-fed kitty, intermittent smelly stools. Okay, we can get back to that one. Let me just finish the allergy one. Parvo's going around with when dogs vaccinated a couple of years ago, and I do again, but I've heard bad things about over vaccinating. Okay, so Sarah, just get them titered. Sarah, about the parvo vaccines, just go get your dogs titered, see what their titers are like before you revaccinate them. My kids have been suffering with gastrointestinal infections. It continues to blame the raw. Okay, well we'll get back to that one too. Blame on diet, that's the same person. Diatomaceous earth for flea controls, really safe if it's ingested by licking. Okay, hold on, what to do. I'm thinking about sclerosis, especially in older dogs. Which is a better product, Phytos Flora or Love Bugs? Stephanie, remind me to go back to that one too.
You got it.
I feed raw diet, 2 meals a day. Is it okay to feed my senior dogs? Okay, hold on. Eosinophilic granuloma and kittens, Sarah Griffin. Yeah, I can, and that's skin for sure. So how about at the very top? Is there more mast cells? Okay, so is everybody sort of put in the chat if they're getting what I'm saying about the allergies before we move on to other stuff? Like with allergies, you want to see, I look at allergies like this. I look at, first of all, when their cortisol levels get increased, they get itchier. They get more stressed and they get itchier. So believe it or not, itching can be painful, can be really painful. We don't know if it's a burning itch because we can't ask them, right? We don't know if it's a burning itch. We don't know if it's an irritating itch. We don't know if it feels like prickly pins. We don't know that. So I usually always give my itchy animals, or my patients, it's itchy animals, arnica. So just to try and decrease we have a product called Your Go-To, and it has arnica and aconite in it, but it's not in the US yet. But giving them arnica, like a 30C or 200C daily for maybe 7 days, just to see if you can help them deal with any kind of pain related symptoms that are coming with the allergies. And then the protocols that we use for allergies are obviously leaky gut and yeasty beast, depending on what if you've got really bad yeast, you've got leaky gut. But probably you should be dealing with the yeast first, then the leaky gut protocol, so that once the yeast is gone, you can heal the gut. If they're really, really bad, sometimes you have to alternate them. Sometimes you have to go 2 weeks yeasty beast, 2 weeks leaky gut, 2 weeks yeasty beast, 2 weeks leaky gut, and you alternate them. And now that we have Phytophthora for the really, really, really itchy, bad dogs out there, I go yeasty beast 2 weeks, leaky gut 2 weeks, Phytophthora 2 weeks, yeasty beast 2 weeks, and I keep rotating them like that. Because Phytophthora now has health claims that we can use about helping the gut permeability. So we're still dealing with the leaking of the gut, but not in a stimulating the immune system sort of way. We're dealing with it with the fulvic and humic acid and the permeability. We're also, Phytophthora now has been proven to modulate the immune system. So every time you guys give a Venectal P, prednisone, any kind of skin disease remedy or drug, you're suppressing 99% of the time. It's an immune suppressive. So, because that's the only thing that because the immune system, like I said, is overreactive. It's reacting to everything because it's been overstimulated, and then it goes into an autoimmune disease. So they want to bring the immune system down. So it suppresses the immune system, and then it goes down. And then guess what happens? They get secondary bacterial infections on their skin, right? So the immune system comes down. It's like, okay, I'm not itching so much, but I'm still itching a little bit. But now my immune system is really crashed and low because I'm on a steroid. So now I'm getting secondary bacterial infections on my skin. So now I have to go on antibiotics. And then the antibiotics is going to trash my gut flora even more. And then it's this crazy vicious circle that's just breaks my heart. And is the whole skin disease is one of the #1 reasons I'm doing this. So, Phytophthora has now been proven to be a immune modulator. So what that means is that if the immune system goes too high, it helps the immune system balance itself, like come back into sort of homeostasis, so it comes back down into its regular balance. And then if for some reason it goes too low because it's stressed on some other level, goes too low and starts getting viruses or bacterial infections, it starts to bring it back up. So it's actually an immune modulator. So by adding the immune modulator in there, it's pretty incredible, along with all the minerals in the fulvic and humic acid that you can only get through fulvic and humic acid. You can't even get those minerals in any other way. The ability for it to help to repair the mucosal lining. So again, you can do it a couple different ways. You can start off with yeasty beast, and then you can do 2 weeks of phytosflora, and then you could do 2 weeks of leaky gut. Then you can go back to yeasty beast, and then you can go 2 weeks phytosflora, or you can even get phytosflora in there twice. So you could do phytosflora to start before you even do yeasty beast, phytosflora, yeasty beast, phytosflora, leaky gut. And the reason that I'm saying that is because sometimes the skin is so bad that it needs breaks between protocols, if that makes sense, because it starts to it almost overheals, if you can imagine, if that's actually something, and it is. So it starts to ramp it up too much, and if there's too much yeast, it kills the yeast too fast, and then you can get a die-off, and then they look itchier again. They really aren't itchier because they're getting more yeast. They're itchier because the yeast is dying too fast, and the toxins from the dead yeast are making it look like it's making them itchier, because there's I think 10 to 15 different types of toxins that yeast create when it's ingesting your dog's skin. And one of those is acetone, which is the nail polish remover. And that's what sort of eats away and makes the skin really, really red and raw. But when they die, they actually produce 10 to 30 times the toxins that they do them when they're alive. So you don't want the die-off. You don't want to cure them from yeast too quickly, or I can't use cure. You don't want to eradicate help the body eradicate the yeast too quickly. You want to do it slow and gradual and consistent. And that's why sometimes doing breaks in between is a really, really good idea. Okay, that was a lot. Okay, so what do we get more questions about
Julie,
it?
you asked me to remind you about the difference between love bugs and phytosflora.
Yeah, okay, so I figured out diet, home of the day, it's okay for me to see bugs or good to see them. Okay, there's a big difference. So love bugs is 14 strains of a very diverse probiotic. It's high colony forming units. There's 30 billion colony forming units in an average serving size. And it's got larch, our probiotic, in it. So it's 14 strains with larch. And phytosflora is what we developed a couple of years ago, based on a veterinarian asking me believing everything that I was saying, but was asking me why we use only human probiotics in animals, which was true back then. And I kind of said, because that's all we have, and no one's done any research with species-oriented probiotics. So phytosflora is the only species-oriented probiotic in the world, and that can make health claims based on research. So phytosflora is made from dog feces, and it's been fermented, and then the bacteria and the strains and the species have been isolated, and we isolated there's two that were isolated, canine 1 and canine 2, and they were isolated based on their immune modulating effect, their effect to be able to suppress pathogens like E. coli, Salmonella, and Clostridium. They were chosen because they're the only probiotic on the market right now that has been proven that it actually stays viable in the acidity of a dog's gut, which we all know is very different than people. So I'm not saying that human probiotics don't work, because our 14 strains are human probiotics. And empirically, we know that they do. But to see what these two canine strains, through mega research in vitro, so in a lab and in live studies, have proven to do is quite phenomenal, and really is raised the bar when it comes to probiotics, and nobody else has that strength. So no other probiotics on the market have those strains but Phytosflora. And so they're both really good. Phytosflora has the minerals in it that Love Bugs doesn't. And I love the way I've developed our products is so that you can continue doing diversity. So the body is, just because we're in holistic medicine, what we're starting to do, we're starting to become very conventionalized. So we look at, okay, this supplement is for this, and this supplement is for this, and this supplement is for this, and this supplement is for this. So we're starting to compartmentalize the body like conventional medicine does. And I don't look at medicine. I'm not saying it's bad, it's right, it's wrong, it's the best. I'm not saying any of that. I'm saying that I don't do that. I don't do that in my clinic. I don't do that when I formulate, and I don't do that in my life or with my own animals. The body is synergistic, and all the moving parts have to be healthy in order for us to ultimately work to our best ability, to its best ability. So when you look at, because a lot of people say, why do you have so many different kinds of probiotics, and how come aren't you scared that your Phytosflora is going to replace your Love Bugs and blah, 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 blah? Not at all, because I don't think anybody should be on the same thing all the time. So when you're on, let's say, Phytosflora, we're looking at permeability, we're looking at immune modulating, we're looking at giving minerals, then we're going on like gut soothe, and then we're looking at, keeping all the mucosal membranes nice and slippery and healthy, and we're looking at membranes of the lungs, and membranes of the guts, and membranes of the nasal passages, and we're looking at soft, we're looking at smooth muscle, right? So, and it's got all the slippery elm and marshmallow root and DGL and nag and all that in it. And then when we look at healthy gut, we're looking at specifically the digestive system, making sure that everything is as bioavailable and digestible as possible. And then you're looking at liver tonic, and then you're looking at this. So when you're in phytosynergy, so when you when you rotate through the whole line, even if you have a really, really sick animal right now, so you're doing a lot about gut, even in the gut products like the yeasty beast, the yeasty beast, the leaky gut, Phytosflora, and Love Bugs, and healthy gut, we're addressing the gut, but we're also paying attention to the rest of the body that synergistically helps the entire body come back into homeostasis and be healthy. So Love Bugs is our simplest probiotic. It's simple, but it's got mega more strains than the majority of the probiotics out there, and a very high colony forming count. The other difference, it's not different because I haven't used anything but large, is our prebiotic is large. And I know you guys know why. I think you know why. And that's because really great probiotics for people are very fructose based. And when I started researching prebiotics in my clinic, I was like, this doesn't make sense to me. And how would dogs get sugar in the wild? And what would be a natural probiotic in a carnivore in the wild? And it would be not just a carnivore, but also herbivores and birds, avians, all that. Like, how would they be getting prebiotics? So a carnivore would be getting their prebiotics through the gut of their prey. So I looked at rats and mice and groundhogs and beavers and elk and birds. And one thing that they all ate as a prebiotic, as a fiber, is tree bark. So larch is tree bark. So in my opinion, larch is the closest prebiotic, species-oriented prebiotic that we could possibly get. You won't see it very often because it's mega, mega expensive to use, like exponentially more expensive than fructose or chicory or any of those ones. But I love it because there's a lot of research in it with diabetes. There's lots of research with it in derailing the metastases of tumors. So love bug and that's why I'm saying all this, because I laugh when I say basic, because it's 14 strains, it's 30 billion colony forming units, and it's got large. So it's far from basic, but it's our basic pre and probiotic. I hope that makes sense. You there, Steph?
Yeah, I'm here. And then what's the difference? Oh, you did say the difference between phytos. It's got the humic and fulvic acid.
And it's the phytos has the canine strain.
Perfect. There's a couple more questions here, Julie, that kind of segue into this. Can you use phytosflora with cats?
You know, you can. I mean, it's not contraindicated. It's not licensed. It's not like labeled for cats, but I have 3 cats on it, and I don't use it exclusively with my cats. I use our Feline Gut Soothe with my cats. I use Healthy Gut with my cats, and I do use Phytosflora with my cats. But I would say I use Phytosflora like twice a week, and I rotate the rest of them. And I think that's because they live with dogs. They grew up with dogs, more dogs than anything else. And I do believe that we all cross species contaminate. So I think I've got bacteria in I'm sure I've got loads of other species bacteria in my gut. I'm positive that I do, because it's impossible. Like my cats lick their bums, or my dog licks horse manure and then kisses me, and I think it's impossible that we don't. So yes, you can, but I would suggest that you incorporate it with like our Feline Gut Soothe or something, so that they're getting it just twice a week.
Perfect. Stephanie's asking, can phytos be frozen with veg mix?
I can.
Yeah, awesome. Mm-hmm. There was a couple of questions here kind of going back to the allergies. Caitlin was asking, could you also use Apis for itchy skin or hives? And there was someone else here, Alessandra was asking, can you give quercetin to help with the itchiness? What can I alternate with?
Both. So Apis is really good for itchy skin. But try and remember, Apis skin would be hot, red, and kind of swollen, right? Like puffy swollen. Think of a bee bite, right? Think of a bee sting. Think of something like that. That would be something that would indicate Apis. And you would just do a low potency, like a 30C, and just do it maybe twice a day for 3 days and see if it works. And if it helps, then you can sort of use it as needed. Other good itchy skin remedies are sulfur, but you have to be so careful with sulfur because you can aggravate really. So you'd have to go low potency, like 30X, not CX is like way lower. Graphites is a really good one. And what you do, and so is Rustox. Rustox is a really good one, especially if they get anxious and restless with their itching. But arsenicum's a good one too. Read Don Hamilton's book, and Richard Pitcairn they have really good books on homeopathy. And I would try, what I usually do is try things twice a day for 2 to 3 days and see. And then if it helps, you can, you can use it then as needed, right? So yeah, you can definitely try that. And then quercetin's great, but you have to be careful of quercetin if your dogs are on drugs. So I don't know if anybody's if they're on heart medication, if they're on insulin sometimes, if they're diabetic, if they have seizures. So if they're on any kind of seizure medication, so just make sure if you want to try quercetin that you talk to your vet. And quercetin isn't long term. So quercetin should be like maximum, I think 3 weeks, 3 weeks on, a month off, 3 weeks on, a month off. Don't keep them on it all the time.
Awesome. I've got another one here from Kim about her cat that has many food allergies, gets chin acne from time to time, seems better when avoiding all the things, but she gets turkey all the time, limited ingredient food. I worry she may develop an allergy to turkey eventually.
And she could, that's for sure. So that's why you want to make sure that you're healing her gut. Like if she's got sensitivities, if she's getting acne, if she's getting stuff like that, you want to make sure that along with the food that you are being super duper duper proactive to try and help her heal her gut and make sure that her microbiome is like super strong and really diverse and healthy. And then that I want to just talk, Sarah Griffith asked about cats with eosinophilic granuloma. Yes. In kitties. For all you cat people out there, it's a beggar. Eosinophilic granuloma. So granuloma is when eosinophilic granuloma always reminds me of something called proud flesh with horses, where they develop too much. The body becomes like an immune modulate and an overactive immune system, so autoimmune, and then it starts to build too much skin, and it gets thicker and thicker and thicker and thicker, and it's itchy and painful, and they itch it and they lick it and they itch it and they lick it, and when they do, it becomes more and more granulated. So the more they itch it, the more they bug it. And someone was talking about mast cells. Mast cells can do that too, right? So it's almost like a histamine or a really strong inflammatory reaction, where then the body starts to overcreate this granulation on their skin, right? So the dermis becomes thickened and large and swollen and bumpy. It's a beggar, but it is definitely immune mediated. It can be triggered from allergies and triggered from sensitivities, but it's immune mediated for sure. And definitely wanting to be doing everything that you can with that for again, the gut, but also stress. Stress can trigger eosinophilic granuloma for sure in cats, 100%. So watch for stress. I love for cats, our Allergies and Oopsies, Hydrastis is golden seal is one of my favorite things to use on eosinophilic granulomas. And the other kitty that had the stuff on her chin. So we have Allergies and Oopsies. You have to be careful because cats are way more sensitive than dogs. So I take chamomile tea. If my cats are that way, I would take some chamomile tea, spray a bunch of Allergies and Oopsies in the chamomile tea, and then try them on a little area of the lick granuloma or anywhere the skin's irritated, and see how they react. And then you can add more of the Allergies and Oopsies to the tea when you're seeing how that they, like every couple hours, just make sure that they're not reacting and it doesn't sting them. But it's a really good one too. Cats when cats start to get skin disease, skin stuff, it can really take off fast, and it can get very ugly quickly. And they're so sensitive and so hard to deal with that it's imperative. I know a really, really, really good CBD oil, like so long as it's 100% organic and is oxygen that it's what's that called when they, oh my god, I'm trying to talk so fast, when it's oh my god, when they extract it, so when it's extracted by, yes, make sure it's CO2 extracted, and topical, like a couple drops on top of eosinophilic granuloma can really help with that. The same with your kitty with its chin, because CBD oil works really well with a lot of people that have herpes. And I think that the chin stuff and the chin acne and the eosinophilic granuloma, I would hazard to guess would be that very nervy pain, and that can help, or a couple drops internally just to help with the stress that goes along with the pain with that skin disease.
Thanks, Julie. I've got a couple new questions here. Oh, there's one about dental health. We're going to talk about dental health next week, actually. We have a whole day about that with Dr. Margot Roman. For Anna, is the protocol gentle enough for my dog with cancer?
My dog currently has a red swollen jaw on one side, which seemed to have started after his dental cleaning. Non-stop licking his lips that suggested antifungal and topical antibiotics. Any supplements you? Okay, even though, yeah, I would give that dog some arnica until we can talk about it more, like bring it to the thing. But I would definitely give it some arnica and diluted owies and oopsies till we can talk a bit more about it.
Okay.
Someone's asking, is the protocol gentle enough for my dog with cancer? Recent blood work, red blood cells are high. Calcium is high. Definitely I mean, I don't know what kind of drugs your dog is on, but Phytophthora for sure is gentle enough. Phytosynergy for your dog, I don't know whether it's got Sheila, I don't know whether it's got skin disease or not. But if it doesn't have skin disease, then I would be highly recommending Phytophthora and Phytosynergy.
No skin disease.
No skin disease. Phytophthora, Phytosynergy, and then our liver tonic. And if it's in pain, I don't know what kind of cancer it is. If it's in pain, our owies and oopsies is really good. And you know what? Even our dump for joints was really helpful, because sometimes their muscles with cancer, their muscles get sore. Their muscle gets sore, their joints get sore, their whole bodies get sore.
It's yeah, she's on Phyto. It's a mast cell, and she's also using the liver tonic. Okay. So the Phytophthora would be a good addition to that.
Really good one. Yeah.
Awesome. Sheila, okay. Have you seen a correlation between environmental and food allergies and feline hypersenthia syndrome? Sorry, Julie.
Hyperesthesia? Where is it? Where's the question?
726. Lynn, too.
726. I don't usually do this, do I?
No.
Oh my goodness. Oh my God, I don't even see a 726. Ask me that again.
Have you seen a correlation between environmental and food allergies and feline hypersenthia?
Hyperesthesia. Yes. I mean, it can all be. I can't stress enough how much we have to be careful of cats' mental stress levels, much more even so than dogs. Mm-hmm. Hyperesthesia is I have a cat with that, and I think that hyperesthesia can be, I think, related to their neck. A really good osteopath, a really good chiropractor really helps my cat with that. Remedies, and Sarah, remedies for cats with a lot of either eosinophilic granuloma or the big bumps underneath their chins and stuff, lachesis is a really good remedy for that. And so is it good for hyperesthesia. So lachesis is a homeopathic remedy, and I would only give like a 30C, something really small, twice a day for 2 days, and see if you guys see a difference in it. But other things that help cats with hyperesthesia is putting your hand on them and not pressing really hard, but fairly hard, just holding it, because when it's open to air, they can even get more crawly and more reactive, sort of. I also think CBD, really good quality CBD, is good for hyperesthesia. But yeah, if they've got, what comes first, the chicken or the egg? There's a lot of people that don't really know 100%. Like if you were to say to any vet, do you think that you really have a really good grasp on hyperesthesia? They probably would have to say no, because I've seen cats even start self-mutilating themselves from it, because I think it goes from possibly an allergy or a reactivity to then them being super stressed, and then the super stressedness turns into like a hyperesthesia, and then they get nerve, or they could have an injury in their back or from turning, or like, I think yes, they could all be related. Work on her gut, make sure that you've got some really, Jean Huff is an incredible cat vet. And she takes consultations, and she's brilliant. So make sure that you're using homeopathics for stress, or even if you're diffusing certain essential oils. Jean has on her website, she's got specific oils for cats for certain things. So, and also Dr. Amara, Tamara, she does consultations too with cats. So cats and dogs too, but you can always do a phone consultation. But yes, I do see L3. Make sure they're eating really well. Make sure that they've got a good microbiome, like a healthy microbiome, and really try and reduce their stress. And you can try those remedies as well.
Perfect, Julie. Thanks. Julie, before we go, could you give us could you give us a couple takeaways for allergies, just as an umbrella to kind of finish off the session?
Yeah, but I just want to talk about really fast.
Yeah.
Hold on, a 10-year-old terrier with mast cell tumor at the base of the so mast cells, you want to really make sure that the liver is as healthy as it can possibly be. So Jim, my good friend and colleague Andrea Ring, is amazing with mast cell tumors. I would definitely reach out to her, and it sounds like she's already on homeopathy. But so for liver stuff, you want to make sure that Berberis, Chelidonium, Carsmarianus, Taraxacum, so milk thistle, dandelion root, Chelidonium, and Berberis are the liver tonic. It's really helpful, and definitely Phytophthora for that, because you want to be able to modulate his immune system for sure. And Anna, with this dog, I just was attacked. My goodness. Metal plate, cheekbone fracture. You know what, Anna? You know what I would, hold on. Dog cytology, seeing bacteria in the skin and giving antibiotics don't seem to help. Now, last year, she's been on 4 rounds. Oh my God. You know what? What I would do, her demeanor is improved in her nose and lips under nose looks swollen and are still red. I'm considering doing the yeast protocol, but I'm not sure. What I would do first with Anna, with your dog, is I would put him on our Jump for Joints extra strength, the strong one. I would give that to her 3 times a day for 10 days and give her phytospora. Just do those two things. And you could get some Allergies and Oopsies and do the dilute Allergies and Oopsies with chamomile tea and do that topically around. And then phytospora and jump for joints. Because when I see this, like, I don't know, your vet should know, but as strictly a homeopath, this is a classic never well since, right? So I would be addressing the trauma, the original trauma, which there is arnica in there, but then there's also stuff for nerve pain, because there can be massive nerve pain right now with her, like prickly stuff, like maybe not something that's going to stop her from eating or whatever, but just like a constant pain. It's got some phytum, it's got ruta, it's got a lot. So do that and let us know, like let Adored Beast know that after you've done that, what has come from that, from doing the phytospora and the whatchamacallit, my gosh, phytospora and jump for joints.
Yep. I sent her a note there, Julie. Marianne has really one quick one. Any suggestions for hyperkeratosis on my dog's paw pad feet?
Amino acids. Sometimes hyperkeratosis can come from when they're a puppy, if they ever had, a run-in with distemper and things like that, like as puppies. But lots of omega fatty acids are really good food. Again, I know I must sound like a broken record, but we are just hitting the tip of the iceberg with the microbiome, the gut. It is so vital for it to be healthy. It can look like a million gazillion different things. Feed her gut, the keratosis thing, feed her gut really well. Make sure that she's on a really good, appropriate, species appropriate diet and amino acids. So phytosynergy is really good. So you could do phytospora, phytosynergy, liver tonic, and make sure that she's on a really, really good diet.
Awesome, Julie. Thanks for everything tonight, for hanging out here.
There's just one thing really fast. I don't even know what time it is. What is the bottom line for dealing with yeast with regards to using fermented foods and pre and probiotics? Can you give too much of these that it might further propagate the yeast when first starting out? And what is the difference between probiotic and fermented foods? Often yeast is confused, yes. So yeast is often confused with allergies, and they often go hand in hand. Often. Like I said, if you've got yeast, you've got leaky gut. There's just you can't deal with one without eventually dealing with the other one. Fermented foods and pre and probiotics depends on what fermented foods. I mean, Answers Pet Food, as far as fermented foods, are my favorite company. Pre and probiotics compared to fermented foods, some animals can, it depends. I mean, I have to tell you that I'm a little bit biased with our phytospora because I love Billy's food. I love it, and I recommend it all the time. And sometimes I tell people, like, just do that and don't do probiotics, and then add probiotics and rotate and all of that stuff. But you're not going to find the phytospora bacteria in any fermented food. It just is that strain's not going to be in there. And I think especially when you're starting out with a very compromised dog, it's incredible. I can't even tell. It's really, really, really helpful. Really helpful. But you can feed too much probiotics, and you can feed too much fermented food, and you can overculture the gut. So often when that happens, it just means that you're not giving enough prebiotics. So, and you're giving, the nice thing about Answers is that they have in the fermented, they have like tons and tons and tons and tons of diverse strains of probiotics. So that's important, and so do we. We've got a lot of strains. So just make sure that you can overculture your dog especially when you're only using 1 to 5 different strains. You can cause a lot more harm than good.
Awesome, Julie. Thank you for everything tonight. That's been great.
Hold on. What are my main recommendations for older dogs in terms of food and supplements? Oh.
You want to do one more?
Well, older animals are like tug on my heartstrings.
Definitely.
I know. I can't say no. So recommendations for older dogs in terms of food and supplements: start, if they're on dry food, get them off of dry food and start cooking their food. That would be give them cooked food to start off. Again, if you're looking at our line of stuff, cooked food, Phytosflora, Phytosynergy, and Jump for Joints, and liver tonic. So that would be, and why? Because you want to make sure that their gut stays super duper duper healthy. The fulvic and humic acid is vitally important for old dogs when it comes to their minerals. Phytosynergy has incredible amino acids in it, which is exponentially important for older dogs, for their eyes, for their hearing, for all of that stuff. Jump for Joints doesn't just help for joints, it helps for their muscles, tendons, ligaments, including eye ligaments, and then liver tonic, because they always need kidney and pancreas and liver, pancreas, gallbladder, and kidney support. Okay.
Thank you.
You're welcome.
Anything else?
No.
Any other ones here you see, Julie?
Just right now, puppy on raw, gently cooked in gut soothe. Maybe Anne, we're dealing with leaky gut and itchy issues right now with a puppy on raw, gently cooked in gut soothe. Maybe she can go back, and maybe go back and listen to when I was telling you about rotating. That would be helpful. But because it's a puppy, then again, you could put them on, leave them on gut soothe. That's awesome. Get them on liver tonic. Henry, it's okay, lovey. Liver tonic and Phytosflora.
Awesome.
And snorting, any problem. Stomach show, Helicobacter, gastritis, and small intestinal inflammation. Nasal passage, has lymph node, hyperesthesia, no cancer, short course of antibiotics and acids. I have gut soothe, healthy gut, phyto, and liver tonic. I've been using these products. How do you recommend I use them? I would add, with that, I would definitely add Phytosflora to it, because again, you're going to add in those strains and help with immune modulation, which is really, 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 really important. And you can increase his phytosynergy, because anything really, really gut related, especially Helicobacter, where you want to increase the immune system, phytosynergy is really, really good for that. So Henry, you can do it twice a day. Henry, shushy. Oh, here we go. Hold on. Hold on. Oh, sorry. And Andrea rang. We've dealt with Helicobacter in our clinic many times without having to do any kind of massive drugs. So Andrea ring would be good, and Katie Canagus would be awesome. Helicobacter actually is something that responds well to natural medicine, really well.
Perfect. Thanks, Julie.
You're welcome.
Thank you, everyone, for joining us tonight. If you'd like to continue the conversation, we also hang out in the Adored Beast Apothecary.
God, let me just do this one. So mast cells, well, he can do, I'm afraid of over, oh my God, there's so much, eh? Oh man, I have so many questions. But this poor 14-year-old Chihuahua do many allergies. I've been starting to cook for him. He's chronic pancreatitis, IBD, and liver issues. I found changing his wheel, case pause. The right supplements. I'm currently using Gut Soothe and Synergy along with calcium and digestive enzymes. Anything else? I also wanted to look into leaky gut because of the tremendous food allergies he currently sees Chinese vet. It's acupuncture, and IBD and chronic pancreatitis. Yeah. Chronic pancreatitis and IBD, Synergy, you can be giving twice a day for sure, because they're actually doing human studies with IBD, with phytoplankton. So you could be looking at that, doing it twice a day. Definitely the liver tonic, because it's got chelidonium in it, and chelidonium is really, really good for pancreatitis, for the pancreas and liver issues. And it's not going to hurt for you to get some phytoflora. But the things you can increase is you can increase to 3 times a day, even with the liver tonic with this puppy. And you could, I would be giving this dog arnica, like I would do arnica, maybe 30 or 200 C twice a day for 3 days, and see if there's the licking, even if because the licking of the paws can be pain, right? It might not be allergies. What pancreatitis is so painful that I've seen lots and lots of dogs look like they've got allergies. They don't have allergies, that they hurt. So what's really great for that is arnicas are brilliant for that. But again, you could give Andrea a ring. She would be able to help you with homeopathics for sure. Okay.
I'm just putting andrearing.ca. Super easy, her website, for you, Rachel, and your Chihuahua. Are you doing one more?
I don't. I'm just, there's
a lot. I know.
So much.
We
always say that we're going to do this for 2 hours when it's just me.
We can try it one time. Maybe we'll start earlier.
Yeah, we can, I know we always say at the end of this, you and I have to figure this out. Yeah. But we do, because there's a lot of really, really important questions in here. Okay. And the good news is the first Wednesday of every month, Julie comes on and answers questions literally about anything. That's the theme of the first Wednesday of every month. Ask Julie anything. And Darcy, no, you're welcome. So yeah, just and Kaylin, our customer support girl, she's amazing. Mm-hmm. She's really, really amazing for to help answer some of these questions too, right? Yeah, she is. And she answers the question. Reach out to them. Or out to her. Yeah, absolutely. Keelan answers the questions at adoredbees.com email. Thank you, everyone, for joining us. Thanks, Julie. You're welcome. See you next week. Bye, everybody. Bye.